Welcome to Healthy Tips in Crazy Times. It's now September. We've been doing this for a year and a half, and the times have gotten no less crazy, as you know. So we're doing this for the benefit of your health. I'm Dr. Michelle Fritsch. I'm the founder of Retirement Wellness Strategies, and clients and friends keep submitting questions, and I am so glad that you do, such that each week we spend 10 minutes reviewing the science of what's been discovered and reported in the week ahead. So let's get started. We're going to start right off with boosters, because I know this has been in the news. Right now, the booster that you would receive will be the same formulation as the vaccine that you received before. So if you've had 2 doses, let's say, of the Moderna vaccine, then your booster would be of the Moderna vaccine, and it'll be the same formulation. Now, each of the companies has been doing some research on potential reformulations, but none of those have even been taken for review by the FDA at this point. So all boosters are with the original vaccine. Now, the best evidence of people who actually need a booster are people who have immune system compromise. So those are people with certain types of cancers or on chemotherapy medications, people who've had organ transplants and are on medications to suppress any sort of reaction to those new organs, people who have to be on corticosteroids for a long period of time. So it's a very specific subset of people who did not have a full response. Their immune system didn't completely respond to the original 2 doses, and they need the third and will benefit from the third. As for the rest of us, my opinion right now, the data is not clear that we really need it, because people that are 8 plus months out from the vaccine now, which is about the longest, the very first people were vaccinated in mid-December, I believe. So they're not even a full 10 months out yet, but it's still keeping them out of the hospital and off the ventilator and alive. So it's not like the vaccine effectiveness just drops away at 8 months. So I would say let's hold for a little while, and I will definitely keep an eye on it as more actual data comes in to determine who else might need a booster and when they actually need it. So again, I'll keep an eye on that for you for sure. Some good questions came up this week about pregnancy, and in particular, if pregnant women should receive a COVID vaccine and whether that puts them at risk. So there are really 2 trials that I could find and that have been kind of talked about in the women's health circles that address this. So one was published in April of this year, and it was called the V-Safe trial by the CDC. And so all women who received one of the COVID vaccines who indicated when they registered that they were pregnant, they were given access to this system that would ask them questions for the next year. So they're already pregnant when they start getting asked the questions, and it follows them for a year, at which point, they would have been completely through their pregnancy, and even if it went to a full 9 months. And so based on that data, which I'll show you in a minute, the instance of any sort of issue related to pregnancy was not different than what we see in typical times, if you will, without the addition of this added vaccine. So no increased risk. And then the Mayo Clinic conducted a trial, and it was just published last month, just a few weeks ago, actually in August. And it was a study of women receiving the vaccine versus women not receiving the vaccine. And they found that of all of the women in their trial, the ones that were vaccinated did not get the COVID virus or infection at all, with the exception of just 2 people. So it was 99 point something % effective at preventing a woman who's pregnant from getting COVID. Now, we do know that getting COVID while pregnant is risky for the mother and for the health of the pregnancy and the child. So we know that risk, and there's no debating that risk, that being pregnant and getting COVID is very risky. So the question is, what about if you're pregnant and you get the vaccine? They found no difference in outcomes. And when they say no difference, it's looking at statistically significant differences. So there might be like one person here and two people there, and one person here and two people here. But when you do the math, it's within the realm of the same instance of those things happening. And again, that one was just published in August. I know some people want longer term data, but again, the vaccine was in the initial part of the regular public, people not within the initial study, only for the last 9 months, basically the length of a pregnancy. And so I applaud the researchers for at least gathering what data they could and for the promising looking results. Now, I do want to show a little bit more detail here. If you can see this, this is the study, the table. I want to see kind of how the data is presented. A results table from the 2021, or the article from April. And so it compared the rate of spontaneous abortion in a pregnancy that was less than 20 weeks along, the rate at a pregnancy that does not completely results in a stillbirth from 20 weeks to 40 weeks, preterm births, small gestational size, congenital anomalies, and neonatal death. And if you look under the published incidence, that tells you the documented frequency over years of data of those things happening in a pregnancy. And then if you look on the right, it shows you what they found in the V-Safe trial so far. This is an ongoing trial, but the data so far. And so you can see that the published incidence of a spontaneous abortion at less than 20 weeks is 10 to 26%. Now I want to pause and explain that variability for a second. The upper end 20 or 26% tends to be recorded when it's like a fertility clinic that's collecting the data, because from the moment that someone has intended to be pregnant, they start monitoring them. And so if the pregnancy terminates in those very, very first 6 weeks, then that would be recorded as a spontaneous abortion. Other data is going to be more from like an OB clinic perspective, where they don't start monitoring the woman until she knows she's pregnant. And usually women don't realize they're pregnant until 6, 8, even a few more weeks in. And so the 10% rate is when from the time a woman knows she's pregnant until the 20-week mark. So to explain it just a little bit differently, about half of the early spontaneous terminations of pregnancy are in those first 6 weeks before a woman even knows she's pregnant. And the other half, the other 10%, are from the time she recognizes she's pregnant until the 20% mark. The V-Safe Pregnancy Registry found 12.6% rate of spontaneous termination in those first 20 weeks. Now another couple, and that was in a peer-reviewed journal. New England Journal of Medicine is a peer-reviewed journal, which means the authors did their math and tabulated their results, and then it goes out to peers, people that had nothing to do with that trial but have expertise in that area, who will then get the data and get the information and the interpretation that the authors made and do their own analysis to make sure that what the authors concluded is true. So it's a huge fail-safe mechanism in research to make sure that peers are looking and confirming that the information is correct before it ever gets published. That was done here. And then some other researchers took the final data, so not the raw data. Now, when you're learning about research, which you do in some of the more advanced doctoral programs, when you're learning about research, you never analyze the final numbers. You always go back and analyze the raw data. Well, somebody did go back and analyze the final numbers in a different way and wrote a publication that said the rate of spontaneous termination in the first 20 weeks was over 80%, 80. That alarmed a lot of people. I was sitting with someone this week who was quoting that data, and they were just horrified, and that no one who is pregnant should receive the vaccine was their conclusion. And I agree. If that's the only data you had, that would be terrifying. But thankfully, a lot of people were terrified and went back to the raw data and reanalyzed it again, and thankfully came up with closer to what the authors had, which is that 10 to 12% rate, which is in line with what typically happens. I mean, maybe too much personal information, but I myself lost 1 out of 4 pregnancies. That is not unusual. And I had a child with a congenital anomaly, had nothing to do with a vaccine. These things just happen on occasion. And so I feel comforted that the rates of those things in these trials so far is very similar to what we experience typically, not in a pandemic and not with these vaccines. If you have more questions about that, I would be glad to answer them or dig deeper for you. The other thing I want to point out is the vaccine adverse event reporting system is open to everybody. If you look here, I hope you can see my cursor here. This is not just for doctors to report into it. Each and every one of you, at the time you get a vaccine or afterwards, if you think anything is related to that vaccine, you're encouraged to put it into this system. It's not a secret system. It's not a manipulated system from what I can tell. Everybody can put their data in. So someone contacted me this week that had an anaphylactic reaction after Pfizer, I believe, after the Pfizer vaccine. And that was immediately reported. Someone from Pfizer contacted them. They're monitoring them closely. They're not going to be, well, they're going to work with their doctor on whether they get a second dose or what they do next. But very much this data wants to be known. So if you were pregnant and got the vaccine and something happened, please make sure your data is in here and make sure your doctor's well aware of it as well. If you had the vaccine and you had some strange reaction, please make sure your data's in here. This is for everybody to put their data in here. And if there are problems occurring, we want to know it. So encouraging everyone to be aware of this and to use it freely. Then I want to clarify this stuff about hospital capacity. There's 2 big factors going on here, and I think this is going to become even more relevant over the next month. We're hearing stories and seeing things that hospitals are to capacity or exceeding capacity. And I shared last week, I've seen 2 instances where people that should have been in the hospital for things completely unrelated to COVID couldn't get in, and one of those people passed away. So this is very real. So there's the beds available, number of beds that exist within the hospital building, but then there's the staff to support those beds. They can't bring in more patients than they have nurses and doctors and pharmacists and therapists and people to treat. And right now there's a real shortage in healthcare providers. And many hospitals are implementing a must-be vaccinated policy that's going to come into, I know here in North Carolina, that's going to come into effect here within the next month. So anyone in the healthcare system that's not gotten vaccinated will no longer be within the hospital to take care of people. So the number of available beds will likely go down significantly. So all the more reason for all of us to be doing all we can to control this spread of the Delta variant and allow our communities to recover and allow our hospitals to keep up with the crazy increase in infections that we've been seeing. Vaccine updates. Johnson & Johnson new data has just come in, and it shows good immunity through 8 months. So I hope that allows a lot of people to breathe a sigh of relief. We've been waiting on that data. And 8 months because that's all the data they have so far with the general public receiving that vaccine. So as time goes on, then we'll know 9 months data and 10 months data, as we go. A booster is likely coming because new data about that was just released. So I'll keep an eye on that for you, and we'll talk about it as soon as that data is available. Moderna's full approval and approval for ages 12 to 17. We're expecting any time now. All of that data has been submitted, and so it's in the review process right now. And then for children 5 to 11, the FDA wanted bigger studies and for longer periods before approving that. So Pfizer believes they're going to have that data later this month, and it's anticipated that Pfizer will be approved for children 5 to 11, or at least be evaluated for approval here in the next couple of months. And Moderna and I believe Johnson & Johnson are collecting that data as well. So we've got several more weeks to wait, I believe, before we've got approval for age 5 to 11. And then Pfizer says younger children 6 months to 5 will be right after that. 2 things to continue to watch. There is a new variant called Mu. Right now, it's not having a big impact in the United States, but I'll definitely keep an eye on this for you. And I'm sure we'll be talking about it more by next week. And then masks. Some parts of the world are doing away with cloth masks and are requiring medical grade masks. The United States, I've not found any guidance on that yet, but I want to give you the heads up. And then part of the reason is we've got so many different kinds of masks. And as we discussed a couple weeks ago, if a mask doesn't fit well, it's not going to do its job well. So if you've got big gaps here, or it doesn't fit across your nose and keeps falling down, or you've got a big gap under here, then that mask is not going to be as effective. So as you sort through the masks that you have, choose to use the ones that are going to fit better, fit across the nose, no big gaps here, no big gaps here. And then we will watch for guidance on the most effective types of masks. But the data is solid, as we've discussed, that wearing a mask makes a big difference over not wearing a mask. And you're not wearing it so much to protect yourself from getting the infection, but rather that if you're carrying it, you're less likely to share it with others. So it's all about taking care of each other. So I want to wrap up with a final big health tip. First of all, this is a tree clinging to grow in a place where a tree shouldn't be able to grow necessarily. I don't know why I'm attracted to those, kind of growing against all odds. I want you to pick a fun phrase. I've got some suggestions here. It can be an inspirational quote. It can be a verse. It can be a whatever. But pick something. And this weekend, I want you to practice really calming yourself. Because again, there's a lot to process, a lot going on in the world. Storms have just gone through and wreaked havoc. We've got another one headed our way. Let's take some time to breathe. So I encourage you to find a phrase and recite it to yourself as you breathe in very deeply. Let that breath sit in your lungs for a while. Recite it to yourself again as you breathe back out, and then relax before you breathe back in. Pick a mantra and pick an image, something serene, something that just really calms you. And I encourage you, when you're feeling stressed, do this. Before you go to bed, do this. If you wake up anxious, do this. Deep breathing with something that just really tells your brain it's gonna be all right. And a beautiful image. And I want to hear how that works for you. Happy Labor Day weekend. Talk to you next week.